Hello, Diaz here, founder owner Greenwood Dental. Today I'll be answering one of the most common questions or most frequent question that we are asked by moms that just had babies and they're nursing their newborn. A lot of you want to stay healthy through the pregnancy and want to stay healthy after the pregnancy, after giving birth. And also want to stay healthy, especially when or if you're nursing your baby. So keeping your recare appointments consistent, very, very important. So we are able to access a lot of the data post delivery or during lactation. So by keeping your recare appointments or standard appointments, make sure that you get x-rays, you get checked by the doctor, make sure we measure around your gums, especially during pregnancy. There are many or high numbers of moms, they react to the hormones, the pregnancy hormones, but also lactation hormones start kicking in, I think at 16 weeks, which is the second trimester, to get you ready for nursing your baby after delivery. So if you come in and we diagnose a cavity, decay has to be cleaned out. Like I mentioned many times in many of my videos, the tooth decay does not wait for us, does not wait for the baby to be born, does not wait until the baby is weaned off nursing. It's progressively growing and in the tooth and damaging the tooth, and you don't want to get to a situation that the damage is beyond repair and it's too late for us to fix the tooth. You end up losing the tooth, ending up with the root canals, and God knows you guys don't like root canals, a lot of you guys, or again losing the tooth or abscessing while you're nursing, because that will contaminate the baby's milk. So if you need Novocaine for a filling, and according to scientists, giving Novocaine to lactating moms is perfectly safe. There's no data supporting that Novocaine can hurt the baby or contaminate your milk to a point that you cannot nurse your baby. Nitrous, if you need nitrous, if you have anxiety or you're scared or you're nervous about your appointment and you want nitrous, the nice thing about nitrous as sedation, it acts really quick in your system, and also the body rapidly and quickly gets rid of it the moment you breathe it out with the oxygen at the end of the appointment. It takes about 3 to 5 minutes for the body to get rid of it, and that's why when we turn off the nitrous, you guys are awake and alert and ready to go. You can drive yourself back and forth. So nitrous will not affect the baby's milk. X-rays, zero effect. Again, there's no data supporting that. X-rays right now, especially they're digital, they are very safe. There's hardly any radiation exposure or damage from the radiation of the digital X-ray machines. Fluoride is a salt, like I said in many videos, a salt that we find in our plants and water in our soil, and there's no concrete data supporting that the fluoride is toxic if you use it, especially if you have it in your toothpaste or mouthwash. Those are minimum quantities, minimal amount that will not harm the baby if you are nursing. All medications, however, that needs to be in a minimal amount, or you need to ask your doctor if you need antibiotics, if you need pain meds, if it's okay for you to take. Everybody is different. It's okay for you to take while you are nursing. Why? Because your body is making the milk, so the chemistry of your body will reflect on the in the lactating milk, and we can actually trace medication and toxins in the nursing milk. So the only thing that I would say to be very careful about, like I said, antibiotics, pain meds, or any kind of medication, of course, you have to talk to your doctor. They have to monitor the quantities and also the indication and the need for these medications. But other than that, you should be in the clear to get any dental procedures, or especially, like I said, x-rays, cleanings, fluoride, fillings, sealants, even whitening, the hydrogen peroxide that we use to do whitening or bleach, it gets dismantled, absorbed by our soft tissue, and it gets destroyed immediately after the absorption. So nothing gets mixed into your bloodstream. So that's also safe. But again, you have to set up your priority. What you need and what you want is two different things, like I always mention. So that's it for now. This is Dr. Slava, wishing you a good day and wishing you a good dental health.